Hey everybody. Normally I make videos about hunting stuff, fishing stuff, just general sports stuff, but today I want to make a video about something that happened to me personally. About a year ago, in March of 2024, I was diagnosed with kidney cancer. And long story short, I had to have my kidney removed, my right kidney. Uh, I know there may be other people out there in the world who are facing similar situation, similar surgeries, and I just wanted to tell you a little bit about it from a 55-year-old perspective. Now, being that I'm 55, a little bit about me: I was in the military for 21 years. Um, I did work as an officer on a cruise ship for 10 years. So up until the time I was up until COVID, really, I was in pretty good shape. And then when COVID came, I worked on cruise ships, so I was in lockdown for a lot of COVID. I spent a lot of time on ships, kind of in quarantine. So I started gaining weight then, and my dog doing something off to the side. I don't know, you might see him walking in and out. Anyway, long story, I was having problems breathing. And I went to the doctor for a CT scan of my chest. And in the process of that CT scan, they discovered the last line of the scan caught the top portion of a tumor. And it was on a Friday, of course. So we got an urgent message, you need to come back to the hospital and have another scan. Of course, we couldn't get there until the following week. And we saw we could log into my file, and I saw it said renal carcinoma, and I'm like, oh my God, what is that? Carcinoma's bad. I'm not a doctor, so I had to look everything up, and it's kidney cancer. So over that weekend, we were obviously stressed, but I took some comfort in the numbers. Most people who have renal tumors or renal cysts, that's what they are. They're cysts. So I think it's 2 out of 5 people over the age of 55 have some sort of cyst on their kidneys. These dogs are all around the tripod, so if they bump the camera, it is what it is. So I thought for sure it's just going to be some sort of cyst. It's not going to actually be cancer. But no, it was actual cancer. And then there's all different types of cancer. And again, I'm not a doctor, so we're not going to get all into that. But what they did for me, they probably are talking about for you. You can't do a biopsy because then you risk spreading the cancer. My tumor was 8 centimeters, if I'm between 7 and 8 centimeters. So that's pretty good size. The initial thing was that they were just going to remove the bottom lobe of my right kidney. I had to wait 54 days before the surgery, and then 8 days before the surgery, the decision was made, nah, this thing's too big. We're going to have to do a radical nephrectomy and take the whole thing, which includes the adrenal gland. Your adrenal gland sits on top of your kidney. Again, I'm not a doctor, but I learned all this stuff. So I lost everything on the right side. Some lymph nodes and such, and then when they actually got in there, it had fused with my duodenum. The tumor had, so they tore my duodenum and had to repair that and such. Well, what about the surgery? How does it go? For me, and I'm fatter now. I'm much fatter now. That's something I want to tell you. My doctors tell me that this is not normal. You don't always get fat after you have kidney surgery, but I doggone sure did. Didn't I, Lovey? My wife sitting behind me, I've been married for 36, 37 years. I've known her since we were like 14 or 15 years old. She's from Savannah, Georgia, and so am I. She's a pastry chef from Savannah, Georgia. She's a teacher at a local technical college for cooking stuff. So I'm doing pretty good to only be right here, to be honest. Come on, a pastry chef from Savannah, Georgia, her whole life, and I'm really. But I digress, if that's the right word. Where was I? The cut. Okay, I go in for surgery. Here's how they cut you. Could cut you anyway, okay? Could be over here, could be here. Most likely, you're looking at a partial nephrectomy, which is just a part of your kidney, because most of these kidney tumors, they catch early enough. They may even catch it and tell you we're not going to do anything for a while because they're going to let it grow. And that's fine. And then when it gets to a certain size, they're going to take a portion of your kidney. But again, for me, they took the whole thing. If they're going to take a portion, they'll take a couple of say it, those tubes, laparoscopic cuts, cut it out, done. Easy peasy. Now, not if you're having a radical nephrectomy, which is what I had. So, and incisions may be over here or there, whatever. Mine is from down there to almost my belly button. Yeah. And it's big enough so that the doctor can actually stick his hand inside there, grab the kidney with his he's got a glove on, with his hand, and then they have laparoscopic. I have a sore over here or a wound, and one down here, and they go in there and they cut it loose. They got cameras in there. They cut it loose, and he's got it in his hand, and then he pulls it out. That's a radical nephrectomy. Hey, somebody's sticking a hand inside your guts and jerking this thing out. You know, we're like cleaning fish here. You know, I mean, this is a real deal surgery. I was in the wing where the women go after they have hysterectomies and such. So that's because they don't do nephrectomies every day. It's not a super common surgery. As a matter of fact, my nurses, and it was in Athens, Georgia, the nurses there told me that they only do 2 or 3 radical nephrectomies a year. So it's not super common. Like I said, at that particular hospital, they put me in there where they put the women that have the thing. So how was the surgery? For me, the surgery was, the recovery, the first week was tough. My wife is behind me, so I was in a lot of pain the first week. I think that part of that pain was because the doctors and nurses are trying to get you moving. They're trying to get you up and this and that. And I think that I was doing too much too soon. What do you think, Lovey? Twisting. Too much twist. You need to get out of the bed, Mr. Henry. I don't want to get out of the bed. And when you do got to get out of bed, you got to twist and get your legs over here, and that cut is going here, and just it's pulling stuff. And I started bleeding again. So, you know, my advice to you is, of course, listen to your doctor's a nurse, but if it hurts, it hurts. And don't just, hey, it hurts. And that was the other thing is, you know, they're trying to wean you off of pain medication as soon as possible. And then I was in a lot of pain, and there had been shift changes and this and that, and then it's like, oh, he hasn't had pain medicine in over 12 hours. I mean, this is like the 2 days after the surgery, you know? I mean, I was in a lot of pain. So that's for you. If you're going to have this surgery and it's going to be a radical nephrectomy, stay on top of your pain management, your pain medications. Stay on top of it. Keep those pain medications coming. Yes, you're going to get constipated. I didn't poop for a week, and that caused me problems, being that constipated, because I don't drink, I don't use drugs, so it caused me problems. But I wish I had kept that pain medication going, because that would have helped. Now, here we go after the surgery. Let's say a week, 2 weeks, you know, moving forward. Big problem for me was I was very sedimentary because I had gotten hurt after the surgery. I did try to walk, and I walked too much, and I pulled a muscle in my groin, and, you know, so I had some issues. And it all comes down to trying to do more than you should do after you have a major surgery like that. Okay, so this first 6 months is a change, and for me, I'm 55 years old. I will tell you that my kidney function numbers have not really improved. I had good functioning kidneys. I lost one, so now my creatine levels are up pretty high. What is it, 1.7? Something like that?
But they're staying the same.
But they're not going up and they're steady. So yours may be higher or lower. If you're younger, it'll probably be lower, because what's going to happen is, if you're younger, your remaining kidney may begin to grow in size physically. That's what generally happens when people are younger and they lose a kidney, or they're only born with one kidney. That kidney grows to be physically bigger than it would be normally. Me, at my age, it can grow, but mine's not. My remaining kidney is stayed the same size. I've been ultrasounded and CT scanned, and it's just not growing. I'm 55 years old, so maybe that's the issue. But I can still live my life, and I'm still cancer. Back to the cancer. After they did the biopsy, they discovered that the tumor was called a
oncocytoma.
Oncocytoma, not Uncle Cy. Oncocytoma. What does that mean? That actually means it's a benign tumor. And I was kind of like, maybe a little bit upset, like, hey, I lost my kidney for a benign tumor. No. This is still a cancerous type tumor. It's just, like you basically won the cancer lottery of tumors. You got a good tumor if you're going to have one. So I don't have to do chemo. I don't have to do any further treatment or anything like that. So that's great. But had this tumor pushed through the duodenum, which I was only a few months away from that happening, this could have been a whole nother issue. Here comes these dogs running, and you're going to be careful. They distracted me. I'm sorry. So if you'll have to determine what kind of cancer you actually have to determine what kind of treatment you have. I actually have a friend in Savannah, a very good friend, who I found out he had kidney cancer as well, and he has to go for immunotherapy to Dallas every 3 months. He gets on a plane and he flies to Dallas and he gets treatment, and he's been doing this for years. So there's so many different things that can be there. What we're talking about today is, what if you lose the kidney, especially the whole thing? What can you expect from the surgery? You can expect it to be a difficult surgery. However, it's a surgery that is not uncommon. It's nothing to be scared of. The doctors know what they're doing. It's like having a full hysterectomy if you're a woman, I would say. I don't know that, but that's what I've been told. It's a major surgery, but it's completely recoverable, and completely your life will go on as before. You need to not do more than you're comfortable doing. And I mean, how many times have you heard people say that? Don't push yourself. And what do? You end up pushing yourself, and then you have a setback, and that's where I am. And look at me now. I am 11 months or so past surgery, 20 to 25 pounds fatter. And this is all because of not getting out and walking and doing, they're having a good time. Getting out, walking, doing all that, that's what you got to do, but you got to do it at a good pace. The other thing is, living in Georgia, one dog is deaf. There's nothing I can do. I can't make him be quiet. I live in Georgia, which is the home of Coca-Cola, Atlanta, Georgia. So when we're born as children, we grow up, drinking this. I mean, they put it in they don't put milk in the milk bottle. They put Coca-Cola in the bottle. I love Coca-Cola. Oh my God, I love Coca-Cola. It's so good. If you're a drinker, you like to drink alcohol, you can still drink alcohol, but you can't be a drunkard, as the Bible says. If you like Coca-Cola like me, I can't have 4 or 5 of these a day. Nobody should have 4 or 5 of these a day. I can have one every now and then. And when I get to have one, I enjoy it, because I don't get to have one every now and then. You're gonna have to go to this, guys and girls. You're gonna have to go to water. I hate drinking water. God, it's just so bland, you know, but this, you're going to have to do it, right? Get yourself a good water bottle or whatever, a good water filter, and drink lots of water. How many liters per day did that guy tell me I needed to drink?
He said about 55 ounces.
50 to 60 ounces a day. I have one kidney. I need to keep that kidney. That's a filter, right? That's what your kidney is. It's a filter. You need to keep that kidney clean. With, you know, keep it pure. You know, keeps pushing stuff through there that's good for it, right? You got to get off the red meat, because red meats have something called purines. And purine, all proteins have purines. Look at me, man, how fancy I am now. I didn't know all this stuff, but now I know it. So meat has this stuff called purines, and red meats have more purines than white meats and such. And you got to stay away from purines. You can have purines like once a week. And that's really hard for me because I like beef. I'm a beef guy. And I like sugar. You got to cut back on salt, sugar, beef, purines. You got to bring that down. Not saying you can't have it. You've got to cut down, because now you only have one kidney. Well, back to the thing about purines. Purines cause crystallines, which, you know, will crystallize in your kidney and cause kidney stones. I'm not a doctor, okay? So this is just layman's terms, all right? And if you've noticed, I got some Dalmatians running around here. Dalmatians are really susceptible to kidney stones, so we kind of know all this from Dalmatians. And then the doctor was like, same thing. You know, you only got one kidney. Purines are bad for you. What else, Lovey, should I tell these fine folks who might be facing this surgery?
Diabetes and hypertension.
Diabetes, hypertension, high blood pressure, you're going to die. Oh, gosh, I shouldn't have said it like that, because
that's the truth.
That's, you know, there might be people out there who are obese, who have diabetes, who, you know, those, I don't mean to be a doomsdayer here, but my doctors, once you lose a kidney, you are at stage 3 chronic kidney disease for the rest of your life. There's nothing you can do about it. What you can do is don't go higher up on the stage 3 level. You need to stay low. If you get diabetes, you're going to be way up there. Now, if you've got diabetes, you may be looking at dialysis treatments, you know, whatever, to prolong your life, to give you a better quality of life. You got to start getting that weight off. That's what I actually went back to work at a construction company after I had the surgery. I couldn't control my diet and such, so I quit my job. Your life is more important than your job, so you got to do what you got to do, right? You got to get the diabetes under control. You got to get the weight under control. You got to get the salt and the sugar and the meat and all those under control. However, you can still live a good life. I mean, this video is kind of long. You can still live a good quality life. You can still play with your dogs, play with your grandkids, go for walks, ride motorcycles, go hunting, go fishing with one kidney. You can do all that you want. Still have sex if that's what you want to do. After the surgery, it's going to be a few weeks for sure before you let that happen, but it's going to happen, right? And you can enjoy your life with one kidney. So if you're looking at having this surgery, don't be scared. If you are obese or you do have diabetes, it's not the end of the world, okay? I'm not a doctor. I'm not telling you you're going to die. But that's bad. That's going to bump you up higher on the complications list. So was that too doomsday-ish, Jennifer? I mean, the doctors are going to tell you the same thing, and you got to get that blood pressure under control. I guess, you know, I know it's a YouTube video, but just put your good energy in the Lord and count on Him. Have faith that it's going to be okay, and it will be okay. Yeah, it's a little painful, but you can manage. I managed. I mean, my wife took care of me, and everything was fine. And I didn't have any visitors during that time either. Just my wife. I didn't let no grandkids come over or anything, because you're going to have a big old cut in your belly. unless you do the laparoscopic. All right. If you have any questions, feel free to email me, message me on the YouTube page here. Again, it's normally a sporting channel, but this is important. And if I can help anybody, just let me know. Okay, sorry for such a long video. Thank you. God bless.